When it comes to mental health, anyone and any race can suffer with some difficulties. And unfortunately, a lot of cultures have a harder time handling them more than others. But there is a group trying to change that. Joining us now is David Aragon with Colorado Access and founder of Glow Up Counseling. Sheila Hughes, thanks so much for joining us.
Thanks for having us.
It's great to be here.
Yes, this is a really important topic. Why is there so much discomfort when it comes to people of color talking about mental health?
So from an African American perspective, there are many reasons, but the top three that come to mind for me, we have a history of oppression, which we're able to survive. We've learned to survive, but mental health care is usually a luxury that we can't afford. We have, like I said, we're able to survive. We've learned that surviving, and now it's time for us to step out and seek things that we like mental health care so that we can thrive. Another major issue is trust. I think it's 5 to 6% people of color that are mental health clinicians nationally. So it's going to be hard for me to share my deepest, darkest and weaknesses with someone that doesn't look like me. And lastly, I think religion is a big piece. Usually, not usually, I step back, but religiously, we always choose God, and now we're trying to find a space where God and mental health can coexist.
So there are a few efforts that Colorado Access is doing to try to make it different, you know, for a lot of communities. Talk about that.
Sure. One of the differences we're trying to make is the representation of who our mental health and behavioral health providers are. Sure. To have more that share the same cultural backgrounds. We're also increasing our offerings of training to become more culturally responsive so that providers know how to build that trust with their members. In the longer term, we're partnering to help the future workforce. We're partnering with MSU Denver and the social work department, and we're excited about the new clinicians that will graduate and become emerging professionals.
I mean, those are some options there. What are some other ways that we can get around the stigma around mental health? You know, that's a big conversation in my home too. I have a 25-year-old and she talks a lot about it, which was something that we never did when I was young.
Right.
That's right.
Yeah. Right. So how can we get around that stigma?
Well, a little encouragement goes a long way. Like you, I shared the same challenge. As a teenager, my brother went through a crisis, and it became a family crisis. In the Latino community, we took advantage of group therapy, and that made a big difference in supporting my brother.
You know, living in Colorado and then, you know, on top of that, being a person of color, it can be isolating.
It can.
So what are some of the things that we can do to just improve that situation?
So we have to be intentional. There are African American communities, but it's not like in the South where it's easy to find other individuals that look like us. So you have to be intentional to find those communities, research, but also in today's time, the internet, Psychology Today, I think ZocDoc, so you can actually go onto those websites and put, you know, the specialty, the background, and the therapist that you want to see.
Well, thank you so much for coming on and telling us about all this important information and have those conversations at home. Just my experience alone, listen, right? Just listen.
Yes.
Thank you, Michelle.
Remember that you can watch all of our interviews on our website. Just go to cbscolorado.com. All right, let's talk a little snow.